Abandonment reaction is an emotional or psychological response that occurs when a person feels that they are abandoned, neglected, or unloved by the people they expect. This reaction can occur in a variety of situations, such as in romantic relationships, family, friendships, or even at work. People experiencing abandonment reactions may feel sad, disappointed, angry, blamed, lonely, or afraid of being abandoned again. They may find it difficult to trust others or to foster intimate relationships with others in the future. For some people, abandonment reactions can trigger feelings of depression or in more extreme cases can trigger anxiety disorders. Abandonment reactions can have a lasting effect on a person's mental health. Therefore, if a person is experiencing a strong abandonment reaction, it is important to seek professional help, such as a psychologist or therapist, to help understand and cope with the associated feelings. In other situations, a person experiencing abandonment reactions may seek comfort and support from friends, family, or the community that can help them recover and feel emotionally stronger. It is important to remember that abandonment reactions are normal and natural. However, with the right support, one can help cope with their feelings and recover their mental health back. There are several ways to cope with abandonment reactions. 1. Talk to a trusted person, such as friends, family, or a therapist can help a person diffuse and discuss the feelings they are experiencing. 2. Don't feel guilty. People experiencing abandonment reactions may feel that there is something wrong with them, or that they are at fault in certain situations. However, it is important to remember that abandonment is not a person's fault, and is not a reflection on their values. 3. Make a plan. Making a plan to occupy oneself with an interesting activity or hobby can help one focus their attention on the positive and improve quality of life. 4. Give yourself time to recover. Recovering from abandonment reactions takes time. One should allow themselves to reflect and to soak in the feelings without feeling pressured to return to routine immediately. 5. Learning from the abandonment experience. Reflecting on the abandonment experience can give a person the opportunity to improve themselves, re-understand important values, and better prepare themselves to deal with future abandonment experiences. It is important to remember that abandonment reactions can happen to anyone, and one should seek help if they interfere with daily quality of life or last for a long period of time. Abandonment is the act of leaving someone or something without care or good reason. The term abandonment is commonly used to refer to the act of leaving a person or pet or property that is considered the responsibility of the person who abandoned them. In personal relationships, acts of abandonment can cause emotional distress to the abandoned person, including feelings of abandonment, failure to achieve confidence or intimacy, difficulty in divorce or detachment. Abandonment can also have a damaging effect on the abandoned person or pet, especially if the reasons for abandonment are unclear. In a legal context, abandonment is the inability of a person or business to comply with their legal obligations, such as not paying bills or ignoring contractual agreement obligations. To prevent abandonment, it is necessary to be aware of our responsibilities towards people and pets as well as our property. If someone wants to resolve a relationship or take other actions that may result in neglect, they should talk openly, honestly and transparently with everyone involved and find a solution that is good for all parties involved. In some countries, there are laws that regulate pet neglect by providing sanctions or penalties for people who intentionally leave their pets without adequate attention or endanger the pet's life. In the context of an organization or business, neglect of staff or customers should also be avoided. Employee neglect can cause stress and dissatisfaction and can even threaten their jobs, while customer neglect can have a negative impact on the reputation of the business and can lead to a decrease in revenue. Neglect can also happen to ourselves, when we don't pay adequate attention to our own physical and emotional needs, such as eating unhealthily, not sleeping enough, or working too hard. Self-neglect can lead to stress, burnout, and even health problems. In life experience, there are many reasons why one leaves someone or something, due to embarrassment, feeling too tired, or being too rude. However, if it is necessary to abandon someone or something, it is important to give adequate attention and tell the reason for abandonment clearly and fairly. Abasia is a disorder of impaired coordination of foot movements while walking or standing caused by balance disorders or deficiencies in the nervous system. Abasia can occur due to several medical conditions, such as Parkinson's disease, peripheral neuropathy, spinal problems or physical disabilities that affect leg mobility. In people with abasia, leg movements when walking or standing are not well coordinated, resulting in a feeling of imbalance or instability when moving. As a result, people with abasia may find it difficult to perform physical activities, and find it difficult to stand, walk or even stop. They may need the help of assistive devices such as canes, wheelchairs or other support devices. In addition, treatment related to the underlying condition should be done with physical therapy, occupational therapy or medical treatment prescribed by a doctor. Any person experiencing abasia should consult a doctor to identify the underlying cause and determine the appropriate treatment. If left untreated, abasia can make it difficult to carry out usual daily activities, thus impairing one's quality of life. The prognosis of abasia depends on the cause and severity of the condition. If the cause is treated successfully, then the symptoms of abasia may improve or even resolve completely. However, if the condition is severe or chronic, abasia may persist and require long-term treatment. Treatment of abasia may involve several physical therapy approaches, targeted at increasing muscle strength and balance, improving posture, and improving coordination of leg movements. These therapies may include gentle exercise, balance exercises, massage, and body manipulation. Doctors may also prescribe medications if abasia is caused by certain medical conditions. Some other ways that can help with abasia are with therapeutic exercise and physical device technology, such as the use of canes, walkers, wheelchairs or other support devices. It is important for a person with abasia to receive support from their family and friends, and get help from medical personnel in recovering from their condition. In some cases, a person with abasia may need to modify their home environment to facilitate their mobility, such as support devices, shower chairs, or other assistive devices, so that they can perform their daily activities more easily. As a preventive measure, maintaining physical fitness with certain sports and a balanced diet can help prevent the occurrence of abasia. If a person has a family history of the underlying condition of abasia, they should consult a doctor to discuss ways to prevent the symptoms from occurring. Abatement. In psychology, abatement refers to the reduction or elimination of negative stimuli or behaviors to improve individuals' mental health and well-being, and promote positive and adaptive coping mechanisms. Abatement can be achieved through various methods, such as behavioral therapy, exposure therapy, cognitive restructuring, and relaxation techniques. For example, in behavioral therapy, abatement may involve identifying problematic behaviors and their triggers, and developing strategies to reduce the frequency or intensity of those behaviors. This may include techniques such as replacement behaviors, positive reinforcement, and punishment. In exposure therapy, abatement may involve gradually exposing individuals to feared objects or situations, starting with a low level of exposure, and gradually increasing it over time until the fear response is diminished or eliminated. In cognitive behavioral therapy, abatement may involve identifying and challenging negative thoughts and beliefs that contribute to emotional distress and replacing them with more positive and realistic ones. Overall, abatement in psychology aims to reduce or eliminate negative stimuli or behaviors that contribute to mental health problems and promote adaptive coping mechanisms that improve individuals' emotional well-being and quality of life. Abatement can also occur in the context of addiction treatment. For example, abatement in substance abuse treatment may involve reducing or eliminating drug use through various methods, including medication-assisted treatment, behavioral therapy, and social support. As individuals reduce their drug use or eliminate it altogether, they may experience fewer negative consequences of drug use, such as physical or mental health problems, legal problems, and relationship issues. Abatement can also occur in the context of stress reduction and relaxation. For example, practices such as mindfulness meditation, deep breathing, and progressive muscle relaxation techniques aim to reduce the negative impact of stress on individuals' mental and physical health. These techniques can help to reduce anxiety and depression symptoms, decrease blood pressure, and increase feelings of relaxation and well-being. Overall, the goal of abatement in psychology is to reduce or eliminate negative stimuli or behaviors that contribute to mental health problems and promote adaptive coping mechanisms that improve individuals' emotional well-being. Various techniques and interventions can be used to achieve abatement, and the specific approach taken may depend on the individual's needs and circumstances. ABC theory is one of the theories in behavioral psychology used to explain the relationship between stimulus, behavior, and consequences. ABC stands for antecedents, behavior, and consequences. This theory argues that a person's behavior is determined by the stimulus antecedents that cause the behavior and the consequences that arise after the behavior is performed. According to ABC theory, antecedents can be the behavior of other people, situations, objects, or emotions that trigger a person's behavior. Then, behavior occurs in response to the antecedents. When the behavior occurs, the consequences that arise will affect the likelihood of the behavior being repeated in the future. If the consequences of the behavior are positive, i.e., provide a reward or desired benefit, then the likelihood of the behavior being performed again will increase. Conversely, if the consequence is negative, i.e., punishment or other negative consequences, then the likelihood of the behavior being repeated will decrease. ABC theory is widely used in various fields, such as psychotherapy, children's behavior management, behavior regulation in the work environment, and so on. In cognitive behavioral therapy, ABC theory is used to help individuals understand and overcome negative or maladaptive behaviors by identifying their antecedents and consequences. In children's behavior management, ABC theory can be used to help teachers or parents overcome negative behaviors and promote positive behaviors. In this case, the teacher or parent will identify the antecedents that trigger the negative behavior, the resulting behavior, as well as the consequences that arise after the behavior is performed. Then, parents or teachers can establish effective strategies to reduce negative behaviors and increase positive behaviors. In the work environment, ABC theory can be used to identify antecedents such as the work environment, the behavior of colleagues or coworkers, or job demands that trigger stressful experiences or negative behaviors. In this case, managers can provide a comfortable, supportive work environment and provide coping strategies to reduce negative behaviors and improve employee well-being. In conclusion, ABC theory is very useful for understanding how behavior is controlled by stimulus or environment, and how behavior can be modified through appropriate strategies. This theory can help individuals, parents, teachers, and managers to understand and overcome negative behaviors, increase positive behaviors, and improve well-being and quality of life. The ABCDE technique, also known as the ABCDE model, is a technique used to help people manage their emotions and thoughts when dealing with disturbing or stressful events. This technique is commonly used in cognitive and behavioral therapy to help people identify, evaluate, and change negative or unhealthy thought patterns. The following is an explanation of each stage in the ABCDE technique. 1. A. Activating event. Identify the event or situation that triggered the unhealthy emotion or thought. For example, the experience of failing a test or presentation, losing a job, or criticism from others. 2. B. Belief system. Identify the beliefs or thought patterns that emerged in response to the event. For example, the belief that failure in a test indicates incompetence, or criticism from others indicates that one is worthless. 3. C. Consequence. Identify the emotion or behavior that arises as a result of the belief or thought pattern. For example, feeling anxious, sad, angry, or feeling insignificant, feeling insecure or socially withdrawn because of the belief or mindset. 4. D. Dispute. Evaluating the truth or validity of the belief or mindset. For example, evaluating whether failing a test really indicates incompetence, or whether criticism from others really indicates worthlessness. 5. E. Effective new belief. Replacing a negative or unhealthy belief or mindset with a healthier and more positive one. For example, changing the belief that failure indicates incompetence to the belief that failure is an opportunity to learn and improve. By using the ABCDE technique, a person can understand and manage their emotions and thoughts more effectively, thereby improving well-being and quality of life. This technique can also help one cope with stress and increase mental resilience. The implementation of the ABCDE technique usually involves therapy or counseling sessions with a professional. However, this technique can also be practiced independently when a person faces events or situations that make them feel stressed or uncomfortable. Some tips that can help in performing the ABCDE technique on your own are as follows. 1. Immediately identify the event or situation that triggered the unhealthy emotion or thought. Try to remember clearly what happened and how it affected you. 2. Note down the beliefs or thought patterns that arose in response to the event. Write clearly and specifically to help identify unhealthy thought patterns. 3. Identify the emotions or behaviors that arose as a result of the belief or thought pattern. Try to record all the emotions or behaviors that arise without talking about them further. 4. Evaluate the belief or mindset honestly and objectively. Try to find evidence that supports or does not support the belief or mindset. 5. Replace the unhealthy belief or mindset with a healthier, more positive one. Try making a list of positive beliefs to replace the unhealthy belief or mindset. In practicing this ABCDE technique, it is important to remember that changing mindsets is not always easy and the effects are not always visible immediately. However, with regular practice and discipline, this technique can help you change unhealthy mindsets into more positive and constructive ones. Abdominal bloating is a condition where the stomach feels full, bloated and heavy. This condition is associated with a buildup of gas in the intestines that causes the abdomen to feel distended, sometimes accompanied by discomfort or pain in the abdomen. Some common causes of abdominal bloating include 1. Consumption of certain foods or drinks such as legumes, dairy products, or carbonated drinks. 2. Digestive disorders, such as lactose intolerance, celiac disease, or irritable bowel syndrome (IBS). 3. More serious medical conditions, such as Crohn's disease, polycystic ovary syndrome or cancer. 4. Other conditions, such as being overweight, stress, or premenstrual syndrome. To treat abdominal bloating, you can do several things such as avoiding foods or drinks that trigger the condition, eating foods that are easy to digest, exercising regularly, and controlling stress. Do not hesitate to consult a doctor if your abdominal bloating symptoms are severe or last for a long time. If it is caused by a digestive disorder or an underlying medical condition, it needs to be diagnosed and treated by an expert. Possible tests include blood tests, digestive tests, or imaginology tests such as CT scan or endoscopy. In addition, you can also make some daily lifestyle changes to reduce the symptoms of abdominal bloating, such as 1. Avoid eating foods that are high in fiber if you are experiencing bloating. High fiber can attract fluid, thus increasing the mass and volume in the intestines. 2. Eat and drink slowly to reduce the amount of air swallowed. 3. Avoid consuming foods or drinks that are high in sugar or fizzy drinks. 4. Avoid cigarettes and alcohol. 5. Exercise regularly to improve circulation and bowel activity. 6. Avoid stress and relaxation exercises such as yoga or meditation. However, if the symptoms of abdominal bloating persist or get worse, you should immediately consult a doctor for proper diagnosis and treatment. Abdominal migraine is a condition of recurrent abdominal pain that occurs over several hours or even days, often accompanied by other symptoms such as nausea, vomiting, loss of appetite, and mood swings. It mainly occurs in children and can interfere with daily activities and overall quality of life. The exact cause of abdominal migraine is still unknown. However, experts believe that the condition is linked to genetic factors and chemical imbalances in the brain, specifically related to hormones and neurotransmitters. Some of the precipitating factors that can trigger abdominal migraine are stress, fatigue, dietary changes, and hormonal changes. Treatment for abdominal migraine usually includes the use of anti-migraine medications and management of the underlying precipitating factors. Likewise, some lifestyle changes such as maintaining a healthy and regular diet, exercising regularly, and managing stress and fatigue can help reduce the frequency and severity of abdominal migraine attacks. If you or a child you know is experiencing bothersome abdominal migraine attacks, it is best to consult a doctor for proper treatment and management of this condition. Apart from medications and lifestyle changes, some other therapies that can help reduce the symptoms of abdominal migraine are psychological and alternative therapies. These include relaxation techniques such as meditation and yoga, acupuncture, massage therapy, and biofeedback. Such therapies can help relieve stress and help children or adults with abdominal migraine train themselves to manage symptoms during attacks. In addition, as a preventive measure, parents can help their children by paying attention to their diet and general health. Ensure that children get adequate nutrition and a stable diet. Also, avoid precipitating factors that may trigger abdominal migraine symptoms, such as lack of sleep or irregular sleeping times. Do not hesitate to consult a doctor if you or a child you know experiences symptoms of abdominal migraine. It is important to correctly identify the underlying condition and how best to manage this condition so that attacks can be avoided or effectively managed. The abducens nerve is the seventh cranial nerve that controls the movement of the eyeball to the side opposite the nerve. This nerve originates in the midbrain and exits through the skull through an opening at the base of the skull called the foramen jugulare. The abducens nerve drives the lateral rectus muscle, an extraocular muscle that produces lateral movement of the eye, or sideways movement. This nerve is also responsible for maintaining the centered position of the eyeball, which is when the eye is at rest in the center position and when looking forward. If damage or injury occurs to the abducens nerve, it can cause several symptoms, such as visual disturbances, nystagmus, uncontrolled eye movements, diplopia, double vision, and the inability to move the eye to the side opposite the affected nerve. Damage to the abducens nerve can be caused by various factors such as increased arterial pressure, infection, brain tumors, trauma or head injury, and medical conditions such as diabetes or hypertension. Treatment for abducens nerve damage depends on the underlying cause and may include drug therapy, physical therapy, or surgery. Damage to the abducens nerve can be further categorized into several types, namely 1. Abducens neuropathy. This condition occurs when the abducens nerve is damaged due to various causes such as pressure, infection, or injury. Symptoms can include weakness in the muscles controlled by the abducens nerve, visual disturbances, or double vision. 2. Abduction nerve palsy. This condition usually occurs in infants or older people and can be caused by lesions or injuries in the brain, high blood pressure, or infection. Symptoms include double vision and difficulty moving the eye to the affected side. 3. Abducens nerve ischemic paralysis. This condition occurs when blood flow to the abducens nerve is impaired, causing weakness in the muscles it controls. This condition can be caused by pressure on the nerve, trauma, or vascular disease. 4. Abducens nerve neoplasm. This condition occurs when there is a tumor around the abducens nerve area that can affect nerve function. Symptoms may include double vision, decreased vision, or weakness in the eye muscles controlled by the nerve. Since the function of the abducens nerve is very important, diagnosing damage to this nerve must be done immediately in order to take appropriate treatment measures and minimize the risk of complications. The doctor will perform a physical examination and diagnostic tests such as CT scan or MRI to determine the cause of the abducens nerve damage and the treatment required. The abducens nucleus, also known as the abducens nerve nucleus, is a part of the central nervous system (CNS) located in the brainstem at the pontine level. It is a motor nucleus located in the middle of the brainstem's tegmentum. The abducens nucleus is the main nucleus for the abducens nerve, cranial nerve V, which is the sixth cranial nerve and is involved in controlling eye movements. The abducens nerve controls lateral eye movements, which means movements towards the ear of each eye. The abducens nucleus receives input from gaze areas in the cerebral cortex, midbrain, and circulatory circulation and sends motor signals to the lateral rectus muscle of the eye. This muscle is responsible for moving the eye sideways. Damage to the Abducens nucleus or its nerve pathways can cause various symptoms. Dysfunction of the Abducens nucleus can result in eye movement disorders. One common symptom is strabismus, which is a misalignment of the eyes or a crossed eye. When the Abducens nucleus is not functioning properly, the lateral rectus muscle weakens, which makes the affected eye unable to move sideways. Damage to the Abducens nucleus can be caused by various conditions or disorders such as stroke, head trauma, brain tumor, inflammation, infection, or neurodegenerative disease. Diagnosis can be made through physical examination, such as looking at eye movements and performing an eye exam. Treatment and management depend on the underlying cause and the extent of Abducens nucleus damage involved. Treatment options include physical therapy and treatment aimed at the underlying condition. In conclusion, the Abducens nucleus is an important part of the CNS involved in controlling lateral eye movements. Damage to this nucleus can result in eye movement disorders, including strabismus and difficulty controlling the position of the eye. Abduction is the movement of taking a body part away from the midline of the body, along the coronal plane. This movement involves muscles that pull bones or other body parts outward from the midline. In the human body, examples of abduction movements include opening the arm from a position at the side of the body to a position above the head, or spreading the legs from a closed or narrow position to a wide position sideways. Abduction can occur at various joints in the human body, including the shoulder, hip, knee, and ankle. Abduction is crucial for maintaining body flexibility and balance of movement. The abduction movement releases tension on joints and muscles, and helps in improving muscle flexibility and strength. Proper abduction exercises can aid in correcting body posture and enhancing balance in daily movements. However, excessive or deficient abduction movements can be symptomatic of certain diseases. Some medical conditions, such as joint inflammation or injury, can limit abduction movements in specific joints. Diseases like stroke and nerve compression can cause muscle weakness and restrict abduction movements. Additionally, certain medical conditions such as scoliosis may involve a lack of abduction movement on one side of the body. In conclusion, abduction is the movement of taking a body part away from the midline of the body, requiring appropriate muscle contractions. This movement is crucial for enhancing flexibility, balance, and good body posture. Conversely, deficient abduction movements can be symptomatic of certain medical conditions that restrict body movements. The Abecedarian Project was a groundbreaking early childhood education intervention program that was developed and implemented in the 1970s by researchers at the University of North Carolina, Chapel Hill. The program was designed to help improve the cognitive and academic outcomes of children from low-income families. The Abecedarian Project was a longitudinal study that followed a group of children from birth to age 21, and its primary focus was on the cognitive and academic development of the children. The program included educational interventions for children and their parents, starting in infancy and continuing through early adulthood. Initially, the program focused on providing high-quality child care to children from low-income families, with a focus on stimulating early cognitive and social-emotional development. The program included individual and group activities, such as reading, storytelling, music, and games, designed to encourage language development and cognitive skills. The program also emphasized the importance of building positive relationships between children and their caregivers. As the program progressed, intervention strategies were expanded to include parent education and support. The program offered parenting classes and home visits to provide parents with information and strategies to support their child's development. The program also provided access to educational and occupational opportunities for parents to increase their own economic stability and support their child's development. The Abecedarian Project was unique in its focus on early childhood development and its comprehensive approach to supporting children and families. The program was successful in improving cognitive and academic outcomes for children, with the children who participated in the program scoring higher on IQ tests and academic achievement tests. Additionally, children in the program had higher rates of high school graduation and college attendance than children who did not participate in the program. The Abecedarian Project has had a significant impact on the field of early childhood education and has influenced the development of other programs and policies aimed at improving outcomes for children from low-income families. The program's success highlights the importance of investing in early childhood education and supporting families in order to improve outcomes for children and increase opportunities for success throughout their lives. The long-term impacts of the Abecedarian Project have been highly influential in shaping the field of early childhood education. The findings from the study have emphasized the importance of early interventions and high-quality care for children from disadvantaged backgrounds. One of the key takeaways from the project was the significance of early cognitive stimulation and language-rich environments. The children in the program experienced enriched educational experiences from infancy, which helped develop their language and cognitive skills. This knowledge has informed the development of various early childhood education programs that prioritize language and cognitive development in the early years. Furthermore, the Abecedarian Project highlighted the importance of parental involvement and support in a child's education. The program recognized that parents play a critical role in their child's development and academic success. By providing parenting classes and home visits, the program aimed to empower parents with the knowledge and skills they needed to support their child's cognitive and social-emotional growth. This emphasis on parent-child relationships and support has influenced the implementation of family engagement components in many early childhood programs today. The Abecedarian Project also shed light on the long-term benefits of early intervention. The children who participated in the program not only demonstrated improved cognitive and academic outcomes during their early years but also continued to show positive effects well into adulthood. They were more likely to complete higher education and secure stable employment. This evidence underscores the importance of investing in early childhood education to break the cycle of poverty and provide children with better opportunities for a successful future. Overall, the Abecedarian Project has had a transformative impact on the field of early childhood education. Its findings have informed policy decisions, program development, and best practices, emphasizing the critical role of early interventions, parental involvement, and high-quality care in promoting positive outcomes for children, particularly those from low-income backgrounds. The project has provided valuable insights into effective strategies for addressing educational disparities and promoting equity in early childhood education. In addition to its impact on the field of early childhood education, the Abecedarian Project has also contributed to advancements in research methodology and evaluation of interventions. The project was one of the first experimental studies to examine the long-term effects of early childhood interventions, using rigorous methodologies and control groups to assess the program's impact. By employing a randomized controlled trial design, the Abecedarian Project provided strong evidence of the effectiveness of early childhood interventions. The findings demonstrated that intentional, high-quality interventions in the early years can lead to significant and lasting positive outcomes for children. This approach to research and evaluation has since been replicated and built upon by numerous studies investigating the effects of early childhood programs. Furthermore, the Abecedarian Project demonstrated the importance of long-term follow-up and evaluation. By continuing to track the participants over the course of their lives, the project was able to assess the enduring effects of the intervention into adulthood. This longitudinal perspective has informed subsequent studies, highlighting the value of ongoing evaluation to fully understand the impact of early childhood interventions on various aspects of development and well-being. The findings of the Abecedarian Project have also shaped public policy discussions surrounding early childhood education and the importance of investing in programs that target young children from disadvantaged backgrounds. The evidence provided by the project supports the idea that providing high-quality care and education in the early years can not only benefit individual children but also contribute to broader societal goals, such as reducing achievement gaps and promoting social mobility. The success and impact of the Abecedarian Project have led to the replication and adaptation of its principles in various early childhood programs worldwide. Its lessons have informed the development of Head Start programs in the United States and influenced similar initiatives in other countries. The project has demonstrated that early childhood interventions are crucial for promoting equitable opportunities and breaking the cycle of disadvantage. In conclusion, the Abecedarian Project represents a seminal study in the field of early childhood education. Its comprehensive approach, focus on cognitive stimulation and parental support, and long-term evaluation have shed light on effective strategies for improving outcomes for children from low-income families. The project's findings have had a profound impact on research, policy, and practice in early childhood education, emphasizing the critical importance of investing in high-quality interventions during the early years. Aberrant response is a term used to describe an unexpected or inappropriate response in a given situation. The response may differ from what is typically expected from an individual or group in the same context. This term is often used in various fields, including psychology, psychiatry, and social sciences, to describe behavior that deviates from societal norms or is inconsistent with accepted patterns. There are several factors that can contribute to aberrant responses. One of them is an underlying mental disorder or problem, such as personality disorders, mood disorders, or developmental disorders. Individuals with these disorders may not be able to control or process information in the expected manner, resulting in responses that are considered anomalous in the given context. Additionally, environmental factors can also influence aberrant responses. For example, social pressure or failure to meet expectations can cause individuals to respond in unusual or unexpected ways. Interpersonal conflicts, high stress, or anxiety can also contribute to aberrant responses. Aberrant responses can also be caused by biological factors, such as neurological disorders or hormonal changes in individuals. Chemical changes in the body can affect cognitive and emotional functioning, which in turn can influence an individual's responses in certain situations. A thorough explanation of aberrant responses could include various examples. For instance, in the context of child psychology, aberrant responses may include impulsive or aggressive behavior that is not suitable for the situation at hand. In psychiatry, aberrant responses can refer to unusual or unexpected symptoms of a mental disorder, such as excessive paranoia or irrational delusions. In the context of social behavior, aberrant responses can involve actions or opinions that violate socially accepted norms by the majority of society. For example, individuals expressing racist or sexist attitudes may be considered to have aberrant responses, as their views contradict social values of equality and rejection of discrimination. Studying aberrant responses is important for understanding various forms of human behavior and the factors influencing them. In some cases, aberrant responses can also be a signal of an underlying mental disorder or emotional problem. Through careful research and evaluation, efforts can be made to understand the factors influencing aberrant responses and develop appropriate intervention strategies to assist individuals involved. As aberrant responses can present challenges in different contexts, it is important to develop interventions tailored to specific scenarios. In many cases, behavioral and cognitive therapies can be effective in helping individuals learn to control and modify their responses in certain situations. Medications may also be prescribed to address underlying mental health conditions or manage symptoms that contribute to aberrant responses. In addition to individual interventions, it is also important to address social and environmental factors that contribute to aberrant responses. Creating a supportive and inclusive social environment can help reduce social pressure that can cause individuals to respond in unexpected ways. Addressing systemic issues that contribute to biases and discrimination can also promote social equity and reduce the prevalence of aberrant responses related to prejudice. Ultimately, understanding aberrant responses requires a multifaceted approach that considers both individual and environmental factors. By recognizing abnormal responses as potential indicators of underlying issues, effective interventions can be developed to help individuals address their challenges and improve their quality of life. Furthermore, studying aberrant responses can provide valuable insights into human behavior and cognition. By analyzing and understanding the factors that contribute to aberrant responses, researchers can gain a deeper understanding of how the brain processes information, how external stimuli can influence behavior, and how social norms and expectations shape individual responses. This knowledge can have practical applications in various fields. For example, in clinical psychology and psychiatry, understanding aberrant responses can assist in the diagnosis and treatment of mental disorders. Identifying abnormal responses can help professionals develop personalized treatment plans and interventions to support individuals in managing their symptoms and improving their overall well-being. In the field of education, recognizing and addressing aberrant responses can be crucial for supporting students with diverse learning needs. Teachers and educators can use this understanding to adapt teaching strategies, provide accommodations, and create inclusive learning environments that promote positive and appropriate responses for all students. Additionally, understanding aberrant responses can have implications in criminal justice systems. By recognizing the underlying causes of deviant behavior, policymakers and law enforcement agencies can design prevention programs, rehabilitation initiatives, and alternative sentencing approaches that address the root causes and reduce recidivism rates. Overall, studying aberrant responses contributes to a better understanding of human behavior and promotes the development of effective interventions and strategies in various domains. By recognizing the complexities and underlying factors that contribute to abnormal responses, individuals can receive the support they need to navigate challenging situations and lead fulfilling lives. Moreover, studying aberrant responses can also shed light on the broader social and cultural factors that impact human behavior. It allows researchers to examine the influence of societal norms, cultural expectations, and systemic biases on how individuals respond in certain situations. For example, aberrant responses related to racism, sexism, or other forms of discrimination highlight the damaging effects of societal prejudices. By studying these responses, researchers can gain insights into the mechanisms through which biased beliefs are perpetuated and explore ways to challenge and change these harmful attitudes. This can pave the way for creating more inclusive and equitable societies where aberrant responses rooted in discrimination are minimized. Additionally, studying aberrant responses can contribute to a better understanding of the impact of trauma and adverse experiences on individuals' behaviors. Traumatic events can lead to aberrant responses such as aggression, withdrawal, or emotional dysregulation. By delving into these responses, researchers can develop trauma-informed interventions that help individuals heal and recover from their experiences. Furthermore, understanding aberrant responses can support the development and implementation of public health initiatives. For instance, studying aberrant responses to health warnings and preventive measures can inform strategies to improve public compliance with health guidelines during pandemics or other health crises. By understanding the underlying reasons behind non-compliance, health authorities can tailor their communication strategies and policies to encourage desired responses and promote public safety. In conclusion, studying aberrant responses has far-reaching implications across various fields and can contribute to a deeper understanding of human behavior, individual differences, and the complex interplay between individual, social, and environmental factors. It offers opportunities for intervention, social change, and the promotion of well-being, equity, and inclusivity.
Aberration is a term used in various scientific fields to describe a deviation or departure from what is considered normal or expected. It can refer to different phenomena depending on the specific field of study. In the field of optics, aberration refers to the distortion or deviation of a wave or beam of light as it interacts with optical systems like lenses or mirrors. When light passes through these systems, it can undergo various types of aberrations that cause the rays to converge, diverge, or become distorted, resulting in a loss of focus or image quality. These aberrations can be classified into several types, including spherical aberration, chromatic aberration, coma, astigmatism, and distortion. Understanding and correcting for these aberrations is crucial in fields such as photography, microscopy, and astronomy to ensure clear and accurate images. In the context of astronomy, aberration takes on a different meaning known as the aberration of starlight. It is a phenomenon caused by the motion of the Earth in its orbit around the Sun. As the Earth moves, it encounters starlight from different angles, leading to a slight shift in the apparent position of stars. This aberrational shift is often referred to as stellar aberration and needs to be accounted for when precise astronomical observations are made. Aberration is also a term used in the study of genetics and biology. Genetic aberrations refer to any variation or deviation from the normal genetic composition of an organism. They can manifest as mutations, chromosomal abnormalities, or changes in gene expression, leading to altered traits, diseases, or developmental disorders. Understanding genetic aberrations is essential in fields like medical genetics, developmental biology, and genetic engineering. In psychology, aberration is used to describe behavior that deviates from what is considered typical or normal. This can include behaviors that are uncommon, unconventional, or outside the mainstream. Aberrant behavior can sometimes be associated with mental health conditions, such as personality disorders or psychotic disorders. It can also be influenced by environmental factors, social dynamics, or cultural norms. Studying aberrant behavior helps psychologists and researchers gain insights into the complexities of human behavior, mental well-being, and societal influences. In summary, aberration is a term used in various scientific disciplines to describe deviations or departures from the expected or normal behavior. It is seen in optics when light waves are distorted, in genetics when genetic compositions vary from the norm, in astronomy when starlight appears shifted, and in psychology when behavior is atypical or unconventional. Understanding and studying aberration in these contexts is crucial in advancing scientific knowledge and improving human understanding of natural phenomena, biological processes, and human behavior. In addition to the specific fields mentioned earlier, aberration can also be used in other scientific disciplines. For example, in geology, aberration refers to the deviation or anomaly observed in rock formations, geological structures, or stratigraphic sequences. It can often indicate unusual or anomalous geological processes, such as faulting, folding, or erosional patterns, which provide valuable insights into the Earth's history and geologic events. In physics, aberration can refer to any unexpected or abnormal behavior observed in particles or electromagnetic radiation. This could include phenomena like the diffraction of light, scattering of particles, or the unexpected behavior of subatomic particles. The study of such aberrations helps physicists understand the fundamental properties and interactions of matter and energy. Furthermore, aberration can also be used in the context of social sciences and economics. In economics, aberration can refer to abnormal fluctuations or deviations in economic indicators or market behavior that go against conventional economic theories or expectations. Understanding these aberrations can provide insights into underlying factors driving economic trends and help economists refine their models and predictions. In the social sciences, aberration can be used to describe behavior or patterns that deviate from societal norms, expectations, or standards. This could encompass a wide range of phenomena, including social deviance, cultural anomalies, or statistical outliers. Analyzing aberrant social behavior can shed light on various social, cultural, or psychological factors that influence human actions and societal dynamics. In conclusion, aberration is a versatile term used in multiple scientific disciplines to describe deviations, anomalies, or distortions from the expected patterns or norms. It provides a framework for understanding and investigating various phenomena across the natural and social sciences, ranging from the behavior of light waves and genetic variations to human psychology and economic fluctuations. By studying aberrations, scientists can gain valuable insights into the underlying mechanisms and complexities of the natural world and human behavior.
Abilify is the brand name for the medication called aripiprazole. It is primarily used in the treatment of various mental health conditions, including schizophrenia, bipolar disorder, major depressive disorder, and autism spectrum disorders. Aripiprazole belongs to a class of drugs known as atypical antipsychotics. It works by helping to restore the balance of certain neurotransmitters in the brain, such as dopamine and serotonin. These neurotransmitters play a role in regulating mood, thinking, and behavior. In the treatment of schizophrenia, Abilify helps to alleviate symptoms such as hallucinations, delusions, disorganized thinking, and agitation. It is also used as an adjunctive therapy in bipolar disorder, either in combination with mood stabilizers or as a monotherapy in the manic or mixed episodes. Abilify is known for its unique pharmacological profile, as it has a partial agonist activity at dopamine D2 receptors. This means that it can both stimulate and block these receptors, depending on the level of dopamine activity in the brain. This mechanism of action is thought to contribute to its effectiveness in treating different mental health disorders, as it helps to modulate abnormal dopamine signaling. The dosage and duration of treatment with Abilify vary depending on the individual's condition and response to the medication. The medication is available in different formulations, including tablets, oral solutions, and injections. It is important to follow the prescribed dosage and directions provided by the healthcare professional. While Abilify can be effective in treating mental health conditions, it may also be associated with potential side effects. Common side effects include sedation, akathisia, a feeling of restlessness or an urge to move, tremors, weight gain, and gastrointestinal issues. Serious side effects such as tardive dyskinesia, involuntary movements, neuroleptic malignant syndrome, a severe reaction to antipsychotic medications, and metabolic changes can occur but are rare. It is crucial to regularly communicate with the prescribing healthcare professional and report any concerning symptoms or side effects to ensure appropriate treatment monitoring and adjustments. In summary, Abilify, or aripiprazole, is a medication used to treat a range of mental health conditions by helping to rebalance neurotransmitters in the brain. It is considered an atypical antipsychotic with a unique pharmacological profile. While it can be effective, potential side effects should be monitored and communicated with a healthcare professional. Abilify has also been approved for the treatment of major depressive disorder as an add-on therapy to antidepressant medications. It has shown efficacy in reducing symptoms of depression, such as a persistently depressed mood, lack of interest or pleasure in activities, changes in appetite, and sleep disturbances. The addition of Abilify to an antidepressant medication regimen can help improve overall outcomes for individuals who have experienced inadequate response to antidepressant treatment alone. Furthermore, Abilify is sometimes prescribed off-label for other conditions, such as anxiety disorders, obsessive-compulsive disorder (OCD), and Tourette's disorder. Off-label use refers to the use of a medication for a purpose that is not specifically approved by regulatory agencies but is based on medical judgment, clinical experience, or scientific evidence. When taking Abilify or any medication, it is important to understand that individual responses may vary. Some individuals may experience significant improvement in symptoms, while others may have a partial response or experience side effects that outweigh the benefits. Regular monitoring and follow-up with a healthcare professional are critical to assess the medication's effectiveness and adjust the treatment plan as needed. It is worth noting that abruptly stopping Abilify can lead to withdrawal-like symptoms or a recurrence of underlying symptoms. Therefore, it is essential to discuss any plans for discontinuation or changes in the medication regimen with a healthcare professional to ensure a safe and appropriate approach to treatment adjustment. In summary, Abilify aripiprazole is a commonly prescribed medication for various mental health conditions, including schizophrenia, bipolar disorder, major depressive disorder, and certain off-label uses. Its unique pharmacological profile and ability to modulate neurotransmitters in the brain contribute to its effectiveness. It is important to regularly communicate with a healthcare professional, monitor for potential side effects, and follow their guidance when using Abilify or any other psychiatric medication. It is important to note that Abilify may not be suitable for everyone. Individuals with a history of certain medical conditions, such as cardiovascular disease, seizures, or diabetes, should exercise caution and discuss their medical history with their healthcare provider before starting treatment with Abilify. Additionally, certain medications, including other antipsychotics and some antidepressants, may interact with Abilify and should be used cautiously or avoided altogether. Abilify is also not recommended for use during pregnancy or while breastfeeding, as its effects on fetal development and its presence in breast milk are not well understood. It is crucial for individuals who are pregnant or planning to become pregnant to have a thorough discussion with their healthcare provider to weigh the potential risks and benefits of using Abilify during this time. Lastly, it is important to remember that Abilify is just one component of a comprehensive treatment plan for mental health conditions. It is typically used in conjunction with therapy, counseling, and other psychosocial interventions to achieve the best outcomes. Regularly attending therapy sessions and engaging in self-care practices can greatly enhance the effectiveness of Abilify. In conclusion, Abilify is a medication used to treat various mental health conditions, offering its unique pharmacological profile to help rebalance neurotransmitters in the brain. It can be an effective tool in managing symptoms, but it is important to carefully consider the potential risks and benefits, communicate openly with a healthcare provider, and engage in a comprehensive treatment plan. Mental health conditions are complex and individualized, and the guidance of a healthcare professional is crucial in finding the right approach to treatment.
Thus our explanation of some of the meanings of the following words. Please click like if you like and don't forget to subscribe to get the next interesting explanation. Thank you.